By the way, for those who know me personally and most of my providers, one of the things we hold very strongly is a high degree of professionalism, and the roles that govern our clinic and that govern all healthcare is HIPAA, where we have to keep people's information private. People who come into our clinic, I want to assure them, no information you share with us will go out, and we do not violate people's privacy. We can only share information with other providers if the patient signs a waiver, or if the patient provided an emergency contact, or if there is a risk of harm to the patient or to others. So, and one thing I need to explain here today, sometimes our community members are afraid to come to us, their own, that will not protect their privacy. But guess what? When they go to the hospital, the big chain hospitals, guess who is taking care of them? Same members of the community. The nurse taking care of you, maybe is your neighbor. The respiratory therapist taking care of you, maybe is your neighbor, even the doctor. So I think the same confidence we have in the greater healthcare system, our community can have with us. I even think it's an advantage to be taken care of by somebody who knows you, because you don't want to make a mistake, because if you do and you meet them at a party, where will you hide your face?
Absolutely right, because from all indication, there are some signs and some symptoms that you might demonstrate that will be kind of unique. For example, if you ask, he's a professional, if you ask him about how many Cameroonians would take malaria to a hospital and then they easily identify that's a malaria, it's difficult for them to, run all sorts of tests, right? But the moment somebody comes and say you come from Cameroon and you have some issues going on, you come to a clinic, the moment you talk to him, you say, oh, malaria. He knows exactly. So that makes it easy. He knows exactly. They will know now the treatment plan to provide to you so that you get it, well, as soon as possible. Unlike the other. So yes, for sure, there's a lot of commonality between what we as the providers, the workers there, they have similar, I'll say they have similar, how can I call it, there's that rapport between them and the people that they come, especially members of our community, because they can relate in many cases, in many situations.
I'll explain this, I'll give examples, but I'm not going to review any information to identify. But I've treated people in the clinic with malaria. People arrive America, within 2 to 3 weeks, they are sick. They go to urgent care and other hospitals, and they just give them any type of antibiotic and send them, but they remain sick. The moment they come to my clinic, I ask, oh, when did you come? They say, oh, I came 3 weeks ago. We all know malaria, it takes 2 to 3 weeks for it to show, and we've treated people with malaria. I'm glad that you added that. Another second thing, when people come from Cameroon, they bring medications. They have different names, different brand names. The moment I look at the medication, I'm able to know the US equivalent because I'm from there. I worked with a foundation before where we went and did free medical checkup in Cameroon. That was in 2017. That afforded me the opportunity to study the Cameroon healthcare system from a first-hand point of view. Wow. The information I brought from there is actually helping our clinic right now. So yes, there are advantages coming to someone who knows you.